WCNC Charlotte. This is Flashpoint.
Thanks for joining us here on Flashpoint. I'm Ben Thompson. Today we continue our conversations with the Charlotte City Council candidates. That's coming up in just a few minutes. But first, a topic that doesn't get nearly enough attention: maternal health. The United States maternal health stats are among the worst in the developed world. According to the CDC, approximately 700 women die each year in the United States as a result of pregnancy or delivery complications. Black women, 3 to 5 more times more likely to die than white women in the U.S. That's why for the past 5 years, past week has been designated as Black Maternal Health Week. It's a cause North Carolina Congresswoman Alma Adams has fought for years, including introducing the Momnibus last year, as it's called. It builds on existing maternal health legislation with in all 12 bills to comprehensively address the maternal health crisis in the United States. Joining us today, Congresswoman Alma Adams. Congresswoman, thanks for coming on.
Well, thank you for inviting me, Ben. It's good to be here. It's a real pleasure.
Yeah, nice to have you as always. All right, let's talk about this. Why in the world, when we look at some of these stats and we say that Black women are 3 to 5 more times as likely to die than white women in the U.S., how did we get here? People probably hear that and are stunned to hear it.
Well, this is it's a crisis actually, and that's why we're moving ahead this week with our 5th anniversary because maternal health and Black maternal health in particular have been declining in this country, and so the gap in care has been widening, and we've got to address the problem. So we understand it, and because we do understand it, we've developed some solutions, and so the Black Maternal Health Momnibus is the solution that we feel. But I just think that we have overlooked this problem. We've had issues with our health professionals and women who have not been taken very seriously in terms of the pain that they may have and so forth, and things have just gone unnoticed and unattended. So we want to call attention back to this issue again. And you're right, this situation is worse today than it was 25 years ago. I mean, if you can imagine that. 25 years ago, it was a lot better.
I think that's astonishing to a lot of people. I don't want to get to the details of the Momnibus bill coming up in just a second, but I mean, for all the strides that people talk about and all the pride that we take upon ourselves sometimes in making things better, specifically for vulnerable communities in this country, this is a case of where things have not only gotten worse, but they've gotten noticeably worse.
Absolutely, absolutely, and we are our country's worse than any other place, and I just think that it's really a crisis, and even in our state, North Carolina. We have some serious problems here as well. Okay, so how are we going to solve this issue? I know there's the Momnibus bill, which is a collection of 12 different bills, honestly, that I know you have passed in the House, and the Senate has yet to act. What all does this comprise? This Momnibus? Well, first of all, like you said, we have a package of 12 bills. We started with 9. And because of the climate situation, because of what was going on with the pandemic, we added additional bills. These bills address social determinants of health. They address women who are incarcerated, women who have served, and I think it just covers. It's a comprehensive package, and we believe that we're going to be able to really come up with some remedies for women as a result of these bills. But you know, as you said, these bills passed as a full package out of the House in the Senate. As a matter of fact, the Build Back Better, as the president was trying to put together, included all of them. So we started a couple of years ago with then Senator Kamala Harris, and I introduced the Black Maternal Health Momnibus Act 2 years ago in 2020 because of the state of maternal health in this country and because it is in crisis. And so we introduced the Momnibus, and when we did that, the country went into lockdown for the first time due to the COVID-19. So we had to do a lot of work to keep the Black maternal health as a part of the conversation. And so the first bill, Momnibus bill, has been signed into law. I joined President Biden, excuse me, for the signing of the Protecting Moms to Serve Act last year. And so we have other big bills in the package that have passed the House or are in various stages of the legislative process, some in committees. But most important is that all of the eligible provisions of the Momnibus were included, as I said before, in the Build Back Better. In addition to postpartum Medicaid expansion, the Momnibus provides a number of provisions investing in social determinants of health that influence maternal health outcomes. It would also fund community-based organizations and help with maternal health outcomes, invest in historically Black colleges and universities to train culturally competent health professionals. We found that that's a problem too. We got to make sure that our health professionals are culturally competent in terms of the people, the women who they see. Climate change was another thing. So one of the bills addresses the effects of COVID-19 and the climate change on mothers. So it's a comprehensive approach to the crisis. We've never tried it before, but it is. This is really vital, and it really can't wait. We're talking about 60% of maternal deaths are preventable. Our nation is one of 13 countries in the world where the rate of maternal mortality is worse than it was 25 years ago. So when I think about when I had my children, things were a lot better. But we have a lot of near misses here in this country, pregnancy-related complications that endanger the life of mothers and the children. I had a near miss with my daughter. So, it doesn't matter what your socioeconomic status is, how much money you have, how much insurance you have, it impacts anyone.
And we should say that to your point right there, it's across all walks of life. I mean, when you talk about women who are at risk, we're talking about veterans. We're talking about, you mentioned incarcerated folks as well, Native Americans. It encapsulates a lot of different groups that we often don't think about.
Yeah, you're exactly right. And, I've talked with women all over the country, either who are survivors or have been victims of the maternal health crisis, or they survived it themselves. And so, as you said, it transcends educational levels, wealth, insurance status. It can happen to anybody, and it should not.
But we all have got mamas, and we need to be taking care of them, and especially in the greatest country in the world. We have to be doing right by them, especially from the very beginning of the process. Congresswoman Alma Adams. Congresswoman, thanks for coming on Flashpoint. As always, we appreciate it.
Well, thank you so much, and you have a great day.
All right, you too. More Flashpoint after this.